how to treat a gummy smile with Botox and why you probably shouldn't. On this show, I'll be talking about a really interesting treatment that sometimes makes people feel happier when they look less happy, and sometimes people look less happy when they look happier. I'll explaining how this all works as we understand the anatomy, the side effects, patient selection, and why you should and shouldn't treat this area with botulinum toxin. In the show, I'll also be sharing a case study I did a couple of weeks ago, my thinking behind how I did this particular procedure, and how it's affected the patient. Apparently 25% of the world actually have a gummy smile, which is simply defined by your lip being more than 2 millimeters above the start of your gums. And there are actually many different treatments for this. In fact, some dentists will even shave the gums to make your teeth longer so that you see less gum. We can also treat it with dermal filler, and in this case, with botulinum toxin. So why are patients unhappy about having gummy smiles? The first thing to consider with this is that it is a spectrum like many things in life, and a small gummy smile I don't believe is unattractive. I think it goes with a sense of openness and expressiveness that mostly we quite like in faces. There comes a point, however, where it becomes either a distraction to those who are observing the smile or to the person who's smiling, so that it stops the patient smiling fully. So as soon as a patient is self-conscious enough to try not to smile, there is a strong indication to solve that problem aesthetically so that they can simply be in the moment and express themselves more freely. So why do some people's lips move up more than others? I think this is actually multifactorial, and it's not just one answer. I think sometimes skeletons are shaped in such a way, particularly if people have strong teeth that are projecting forwards, that it's almost easier for the lip to fold and slide off the teeth and reveal more of the teeth than in other people. And in some, it's simply about the strength of the muscle, the relative strength of the lip elevators compared with the depressors, and the way that the skin and the muscles are attached, the geometry around those things that just lend itself to pulling too strongly in a superior action. But it's never just one thing. So interestingly, you'll notice that some patients actually develop a gummy smile as they get older. So their face becomes more dynamic, hyperdynamic in fact, as they lose fat that resists the action of the muscle. So you'll see a 70, 80 or 90-year-old person do a big smile that pulls their mouth right up in a way that a 25-year-old won't, even if it's the same person, which would be hard data to get. But the principle stands that decreased facial volume increases facial dynamics, which can increase a gummy smile. So that tells you that volume can also be a cure. And this is why sometimes dermal filler is an appropriate treatment for gummy smile, not just relaxing the muscle. Typically, I would choose to use botulinum toxin in a younger patient with a smaller gummy smile, and use filler and Botox in combination with people who are either older or who have a much bigger action caused by their lip elevators. It's also important, if you're going to treat a gummy smile, that the patient has signs of volume loss if you're going to use a filler in that area. So typically this means a nasolabial fold, a shadow, that you can then fix that problem and reduce the movement of the lip. How common is this treatment? Well, although a gummy smile is pretty common, they say 25% of people have one, I don't think it's particularly common for patients to ask for it. This might be because people get used to it. Unlike a lot of the triggers for treatment that we have that are triggered by aging, a gummy smile is typically something you've always had, and it just becomes part of your identity. So many patients are not particularly concerned by it. Sometimes triggers are after a patient gets their teeth fixed, they suddenly realize that they still haven't got the smile that they want, and it can be appropriate then. Many dentists will do this as part of a consultation to talk about modulating the top lip. And it also often comes up as part of a lip consultation, because if you're consulting someone properly with lip treatments, often one of the reasons that they want a lip treatment is to cover their gums because they want to lower it slightly. So you can do this with a little bit of filler, but only 1 or 2 millimeters, and then the rest needs to be done with either dampening the smile with filler or botulinum toxin. Before you rush in and do this procedure on everyone with a gummy smile, there's something really important that you need to know about it. This procedure is unique in one particular way, which is that you can create a beautiful result that looks great on a photo that your patient and their friends and family hate. Why is that? It's because the dynamics of the face change. If you change someone's smile, it changes a very important part of their communication. And sometimes they will look slightly odd to people who know them well, but not to strangers. And that's because we actually know how our friends and family's faces move when they're being authentic. And when that gap develops between what you know and the change in an important expression, it can create a sense of distrust or confusion. Are you really laughing at that joke, or are you being sarcastic, for example? So this is just one of the potential downsides of this treatment. The next is it's very easy to overtreat, and then you get what many patients will call the cat in the hat appearance. So this is this sense of a really long philtrum and a strange smile that pulls upwards because of over dampening of the lip elevators. If you don't want to make your patients look like the cat in a hat, you need to use very low doses and learn their faces first and put up with the extra workload of getting them somewhere good rather than just dolloping in a standard dose for everyone, where a good percentage of your patients unfortunately will get this side effect or the other one that I just mentioned. So let me share with you a case study. This is my producer Layla, who had noticed that when she smiles, she had a slight gummy smile, and we thought we would make a small adjustment and see if she liked it. Thankfully, she seems to love the treatment. Let's have a look at before and after, and I'll talk you through my thinking about how I did this procedure. This is a very small adjustment, but there are two indications for this treatment. One is she has something which I call resting producer face. Now, Layla is behind the camera here telling me to do an impression of resting producer face, but essentially it's this, which sometimes makes me feel when I'm being videoed that I'm doing something wrong because she looks either confused or disgusted. And that is one of the indications, which is there something we can do just to soften that? Because actually she's not feeling those emotions most of the time. The second one is that when she smiles, she simply elevates her lip a little bit higher than is ideal, and you see more of that, of the gum. So a proper gummy smile. So the two things we thought might be amenable to a small dose of botulinum toxin. Now, my thinking around botulinum toxin for gummy smiles is that less is more, because I can always add more later, whereas you can't take it out. And so a small adjustment first time around is better than a fuller dose. So I elected to only use 2 units instead of many practitioners would use 3 or even 4 units each side. But I feel much comfortable with a 2-unit dose. And as you can see, it's actually worked out perfectly in this case. So her dynamic movement now is still very natural. I can't tell that anything's shifted. But when we look at the pictures, we see she has a more technically beautiful smile. And then the other thing that's interesting is that her natural resting expressions are still hers, but just slightly softer, which I think together adds up to an interesting and a successful result for a very small amount of toxin with 2 very simple injections. It's a lot like treating a nasolabial fold with a bolus-like technique, where you essentially just slide the needle in until you touch the periosteum and do a 2-unit injection either side. You don't actually have to go as deep as that. You can go a little bit less deep, but it's a safe place to inject, and it does the job reliably well, and there are good landmarks there that make it easier than some of the other injections you might see where people inject more laterally or superiorly than that. If you found that interesting and you want to learn much more in a much more structured way, make sure you click the link below and check out my membership.